All right, friends, good morning. Do you know your ABCs of skin cancer? Well, May is Skin Cancer Awareness Month, and this morning, board-certified dermatologist Dr. Groff is here to check some moles. This is a really good time as the temperature is not like today, but last week I was thinking about this a lot, about sunscreen and protecting your skin. What is the most biggest misconception, Dr. Groff, when it comes to skin cancer?
I think the biggest thing is that skin cancer only affects older patients. As a matter of fact, we're actually seeing a high increase in skin cancers in younger patients. And when I say younger, I mean patients as young as 20s to even 30s are getting skin cancer. So it's very scary. So it's very important. This month we're dedicating to skin cancer awareness. We're actually offering free skin cancer exams at our practice. So I'd love to see people come in so we can make sure that they're safe and healthy and don't have any skin cancers.
We're going to talk about how you can do that in just a bit. But first, Dr. Groff, can you tell me what types of skin cancers are the ones that you're seeing more often?
Sure. We're seeing an increase in all types of skin cancer. The most concerning skin cancer is melanoma, because that's the one that, if not caught early, can be fatal. Melanoma is the skin cancer that looks like a mole that's going bad. It's getting bigger, it's getting darker, it's enlarging. It's starting to itch or bleed when it didn't before. So these are the things that we look for.
We're going to do a check, and we're going to show our friends at home and also have advice for the little kiddos that they're getting out in the sun. But first, I want to go over the ABCs of skin cancer. So A would be to look for
asymmetry. So if you look at a mole, it should look relatively the same in either half if you split it in half. So it should be symmetric.
Symmetric. And B is that borders are...
Yeah, it stands for the borders should be nice and smooth. They shouldn't be cut in and out or irregular.
Okay, and the C would stand for?
C is color. So usually a normal mole only has one, maybe two colors. If your mole has all different types of colors in it, that can be very concerning and needs to be looked at.
Okay, as you see there, the D, that's...
For diameter.
Okay.
So if a mole is larger than the size of a pencil eraser, that's something dermatologists would like to look at and make sure it's okay.
And then finally for E.
E can stand for evolving or enlarging. So that means changes in the mole. Is it getting larger? Is it starting to itch when it didn't itch before? Is it starting to bleed when it didn't bleed before?
Okay.
These sort of things.
What is the best way we can protect ourselves from skin cancer?
Well, using sunblock first and foremost, and trying to avoid direct sunlight at the prime time or the prime times of the day, which would be between 10 and 2 o'clock. But we have a lot of great sunblocks nowadays that do a fantastic job of protecting us.
Okay, we're going to check for moles. This is a good way, like people at home maybe can learn how to do this sometime today.
Is Jacob. We borrowed him from G Crew.
Okay.
So we're going to do like a mock skin exam on him. So usually when a patient comes in, what we do is we first go through their hair, because you can actually get skin cancers on the scalp.
Okay.
So it's important to look through a patient's scalp.
With fair hair, I know our executive producer JR, he has red hair.
Yeah, fair skin patients
are more because of their scalp. Okay.
So Jacob's a little bit more sun protected than, say, a redhead, because he's got a little bit more olive skin, but that certainly doesn't exclude he can certainly get skin cancer. Some of the most common sites for skin cancer are the ears and nose, so we always look those over very carefully.
All right.
And then, of course, we look at the whole head and neck, the chest, the abdomen. We even check the bottoms of the feet, because you can get skin cancer on the bottoms of your feet.
Really?
Yeah.
That's not a place that you would think is exposed to.
Well, sometimes skin cancer can develop in places that aren't sun exposed, like the underarms, for example, and the hands and feet. So we check all those areas.
Okay. You want to do a back check too?
Yeah, let's take a quick look at Jacob's back.
All right.
So you can see, right there, for example, there's a mole, but you can see it's only got one color. It's nice and small. It's uniform, so that's of no concern. So his back looks really good. I don't see anything to be concerned about.
Okay, I want to get the kiddos in. Thank you, by the way. Because this is a big concern. I know I try to get my husband to put sunscreen on our kids all the time. He doesn't do it.
Right, exactly. Well, okay, so we got Jenna and Piper, and they're both wearing sun protective clothing. This clothing is great because it can provide 100 times the protection that maybe a sunblock could. So they basically have an SPF of 100 on right now with this clothing. It's also important to remember to use something to protect their face, like a visor, or even better is this broad-brimmed hat that Piper has on. We don't want to forget about the eyes. We always want to have our kiddos wear sunglasses, because there is a form of skin cancer that can occur in the eye, and it's very deadly. So we always want them to wear sun protection. Now, as far as sunblocks are concerned, I have, well, she's got one right here, but...
Okay.
It does not sting your face when you put it on.
It does not sting your face? Actually, you're so cute. I actually have a question, Dr. Groff, before I let you go about this. For those that might say that sunscreen actually causes cancer, what would you say to them?
That's completely been debunked. There's no truth to that at all.
Okay.
Okay.
Really good information. We should get you back and one time do something on sunscreen. We're out of time right now
Okay.
to go out of all this stuff. But this will give you a good idea to maybe get like a check, and then you're offering the free checks at your
Yeah,
office?
free checks at our office this month.
And there's the information right there.
Yeah.
FoxEyeSanDiego.com will get you all hooked up. Miss Foxy Fox will send it into you.
Wave, girls.
Shelly, the ladies in the newsroom want Jacob to stick around.
Yeah, right? So do
I just want him to hang out. All right, thank you for that. Coming up on the Fox 5 Morning News at 9, the baby coveralls being recalled because of a choking hazard. And the FDA has approved a new treatment to thin your thighs, how it works, and who's the best candidate.
There's a